Hello, my name is Ariana Kelly da Silva. I'm from Brazil. My work is about use of the terms race and ethnicity in public quality health in the American continent. Concepts to be reconsidered. It's my poster. So, in the introduction, I would like to talk about the use of the terms in race and ethnicity are used in epidemiological research in Brazil and uh, in the USA and the other countries to understand how these categories and the race and racism and discrimination can uh, be applied in the public or collective health. In this map, we can see the Human Development Index about the race and self-declared color in Brazil. And in the north, the Amazonia, the population have more self-declared black and brown, like the social identity and more terms about it. In our methodology, we use bibliographic data and we can see a lot of aspects of race and ethnicity in epidemiological application of health and disease of varied populations. For example, in the last census Brazilian Bureau, now 51% of the population in Brazil self-declared like I'm brown or I'm black. It was the phenomenon that the first time that Brazil, the majority of the population self-declared like I'm black. It's because in Brazil, our declaration is different, for example, of the United States, because there in the United States, the population self-declared only I'm black or I'm white. But in Brazil, we have different colors and different symbologies and different aspects to understand how the identity influence in your lifestyle or in your health or in your cultural region and other aspects, and how we can see in this uh, image our population have one diversity specific to phenotype, and we can have white and black and brown, indigenous and Asians uh, in the diverse aspects, cultural and identity and other situations to understand uh, our aspects of culture and biology. We have some results about the approach of the concept in the context of public collective health and clinical practice. And this observation about race and ethnicity has been used to identify populations that receive unequal treatment in the health system in Brazil, because our health system is public, like Sistema Único de Saúde, SUS, or it's public and gratuitous for free for every people or every population in Brazil. But the racism and the structural racism are one reality in our country. So, according to socioeconomic status that influence and access and the care for human health um, have one not equal treatments for black or white or brown or indigenous and others social identity. So in Brazil, we have multi-ethnic identity and fluidity ethnic, and there's ethnic groups since the our US Census, science, the comparative US Census, we have the difference, like the black, white, or indigenous populations. But in Brazil, they apply specific categories for race, color, and self-identity to generate public policy. And these factors, unfortunately, are inconsistent in epidemiological terms. For example, in this image, data from the Ministry of Health show the mothers who died from causes related to pregnancy, childbirth, and postpartum in the stage are young, black, or with low education. In Brazil, for all maternal deaths among young people, black women account for 55.3%, while the whites is about 45.5%. And as we can see in this figure one, and the we have a lot of cause of death in Brazil, like hemorrhage, hypertension, peripheral infection, abortion, and others. But the people and the mothers, the black mothers, have more problem in this treatment, in the access, in their income and other situations to have one good maternity, or you can how we can see um, the black woman don't have one positive consequence in your maternal uh, pregnancy. Okay, here it's one uh, research, it's mine research about income and self-declaration of color of people with sickle cell disease or sickle cell anemia in the Amazonia. And in my thesis, I found that the black woman has um, one specific uh, difficult to have access to have uh, employed or to have education or to have the style of life with quality of life, because the poverty in the Amazonia reflects about the specific situation or specific categories, like identity, like if I'm black or I'm white or if I'm brown or indigenous, um, my phenotype and my social condition reflects in my quality of life. And unfortunately, the black woman have more specific problems to have one good treatment in all aspects of their lives. Here, it's about one other result of my thesis, and uh, I asked for 6 people, like how you genetic ancestry of autosomal DNA and how the self-declared color influence about the uh, clinical manifestations, and uh, between the European DNA, American DNA, and African DNA, we found that the uh, people with sickle cell disease with African DNA has more specific um, manifestations. There are not uh, nor how can I say, not more the gravity or the severe manifestation. So if I have sickle cell disease in Amazonia and my ancestry or my genetic ancestry is African, the clinical manifestations uh, no too severe like American DNA and European DNA. So the African populations about the genetic ancestry have one protection or one ancestry protection about clinical manifestation in sickle cell disease. But not only the genetic ancestry, but the self-declared color influence too about the specific clinical manifestations in the Amazonia. In the Brazil map, it's the, the the color or a lot of colors represent the white, the brown, indigenous, and black populations. So, and our diversity is one whole genetic or one great example to understand how studies about uh, race and ethnicity are important to have more uh, aspects to new research or new investigations. In our conclusions, we found that a multidimensional construction of race and ethnicity is necessary in the contribution of more effective tools and methodologies in the classifications to understand the complexity of the self-declaration and uh, how we can understand the specific case of race, color, clinical manifestations, and epidemiological health, because everything involves social factors until now insufficient for a better understanding of the various social realities uh, and the concepts in questions. It's our reference. Any questions? Thank you so much.